I am Dr. Ashi, and I'm joined today by Dr. Amanda Rios. Hi.
Hello. Hi.
So, Dr. Rios is the owner of Core, where I work. One thing that I know that you use, which is an orientation in therapy, is internal family systems.
Yep. Dr. Richard Schwartz was the creator of IFS, as you probably know. We're not a monolithic personality, right? Is what he said.
Mhm.
And, we all have multiple parts inside of us that are
Mhm.
operating simultaneously, trying to keep our system alive, right? Internally,
Mhm.
right? And so internal family systems, IFS, looks at the different parts that we all have. And this is everybody. Everybody has these parts,
Mhm.
whether you think you have them or not. And
Mhm.
this is nothing to do with like multiple personality disorder or anything like that. Let some
Mhm.
people kind of confuse the two. But this is really looking just internally at yourself and how you're motivated, and your behavior might be motivated and your feelings are motivated by different parts,
Mhm.
um, all with different intentions, all with different purposes. And think of the last time you made a decision,
Mhm.
right? And it was not an easy one, right? Like you had to waver, right? You might say, part of me wants to go to this thing, part of
Mhm.
me wants to stay home, right? So
Mhm.
already you're introducing that idea that you could have different parts of you with different motivations. We all have this part of us. Well, there's us, there's the self, right?
Mhm. Mhm.
So all of us have this natural leadership potential, this natural leadership, compassionate potential, um, that, you know, can be really curious about others and about yourself. And that, we call that the self, right?
Mhm.
Um, and that's really who we are at our core, right? The
Mhm.
self is who we are. But then there's these other parts, right? So the first part I'll talk about is called the exile part.
Mhm.
People connect to this part instantly whenever I mention it to them for the first time. The exile parts are, and there can be more than one. It's not just one necessarily. There could be more than one exile part. But exile parts hold things like shame and pain and feelings of inadequacy, feelings of rejection, all of
Mhm.
those like really vulnerable feelings that all of us have, right? Um, and that part, the different exile parts are usually very young. So like if we can think back, one of the things I'll have clients do is think back to, how old that part might be, right? And they can usually pinpoint it to be very young. They might say like, I think it's probably 6 or 7 years old, right?
Mhm.
And it might be traced back to a memory or an experience or a time frame in their life where those feelings were pretty, you know, exacerbated, right? That feelings of shame, loneliness, those types of things.
Mhm.
Um, and it is really hard to live in those feelings all the time, right?
Mhm.
So those are really important feelings because it tells us something about our history. It tells a narrative. It tells us about ourselves, from a very early time in our lives, right?
Mhm.
And those feelings exist even many, many years later, right? But what happens is we can't live in that constant feeling of loneliness and rejection and shame all the time. So
Mhm.
we need to have protector parts that come in to help, right?
Mhm.
And so these protector parts are there and function very well most of the time. You know, if you set an alarm clock, right?
Mhm.
That's one of your protector parts, making sure you're not going to be late to work or to school or whatever,
Mhm.
right?
Mhm.
That part that kind of works very um, proactively is called like a manager part, right?
Mhm.
So there's two protector parts. One's called the manager part, the other is a firefighter part. The managers work to help us function and proactively take charge of our lives. The other part, the other protective part is called a firefighter part.
Mhm.
Firefighters are more reactive, sort of like, I feel this thing and I don't want to, so I'm out of here. right? We're going to escape this really sad experience, or we're going to escape this really bad moment, and we're going to avoid it. In our best, most healthy lifestyle, we use our manager and firefighter parts all the time in a
Mm-hmm.
way that doesn't really have a negative impact, that has a very positive impact because these are good parts. Dr. Schwartz has a book called No Bad Parts that people can look up.
Mm-hmm.
It's a good one to kind of get an introduction to IFS and things like that. But these parts are functional. They're good for us, right?
Mm-hmm.
So we do need to be able to get to work on time. We do need to be able to um, keep track of what we're doing and make sure that we're being proactive so that we don't fall through the cracks. And yet, what the theory says, and this is something that I see over and over again, is that when any one of those protective parts is overused because of something like trauma,
Mm-hmm.
that's where the part sometimes becomes so burdened. That's what we call it, a burden, right?
Mm-hmm.
Um, that it ends up making choices that might actually imbalance the system a little bit. OCD symptoms, for example,
Mm-hmm.
right? Like just always checking, always checking, always checking. That could be an example. Or it could look like alcoholism, right?
Mm-hmm.
If somebody is too much in their firefighter part is too burdened, then that part develops maybe a substance abuse problem.
Yeah, so it sounds like the manager and firefighter parts, they aren't inherently good or bad, and
Right.
that a
They're needed.
firefighter, yeah, they're
Yeah.
needed,
Hmm.
but that depending on how burdened they are, how they're manifesting for an individual, that might be the difference between someone who's coming into your office for alcohol abuse
Right.
versus somebody who works really hard and then sometimes says, you know what, I need to go see a
Yeah.
theater show or something as a way to just,
Exactly.
okay. Yeah.
Right. That's right.
One thing we talked about was conceptualizing IFS through a fictional character so people would understand it.
Sure.
And so we talked about Simba from The Lion King.
Okay. Yeah. That's great. The Lion King is an excellent story about IFS parts, to be
Mhm.
honest. One of the things that we know, right? We all know Simba was this little cub, right? Living in
Mhm.
his pride, Pride Rock, the whole thing. And he had this awful thing happen to him, which is that his dad was murdered in front of him by his
Mhm.
uncle.
Mhm.
Um, but it was blamed on him. He was told by his uncle that it was his fault that his dad died. And like
Mhm.
that trauma and that pain was so intense. Um, and as a cub, he didn't know what to do with that, right? So if we're
Mhm.
thinking about exile parts, Simba, like if Simba was all grown up when he is all grown up and he goes to therapy, right?
Mhm.
That's in the next movie.
Yeah.
Um, Simba, if we're thinking about exile parts, you know, he's going to trace exile part back to that moment when
Mhm.
his dad died, and it was his fault. Whenever anything reminds him of that experience, of those feelings that are held by that exile, that's definitely going to come up for him.
Mhm.
So in the movie, what does he do? Simba goes to the middle of nowhere and meets these other outcasts. So he meets what? Pumbaa and Timon,
Yeah.
and their entire song is about Hakuna Matata, which is no worries, right? So when
Mhm.
something bad happens, we just say Hakuna Matata, right?
Mhm.
So Simba is now utilizing this firefighter part of him and saying, you know what? Bad things happen. No worries. I'm going to just live here and I'm going to learn how to eat bugs and whatever else they do,
Mhm.
do dances on a log or whatever. So
Mhm.
that's their whole thing. He's literally and figuratively escaping his problems
Mhm.
by being
Mhm.
in this
Mhm.
little oasis with his new friends. Later in the movie, his best friend and future wife, Nala, comes
Mhm.
um, to the whole scene and, is like, what are you doing? Why are you not back at Pride Rock? Right. And he is really angry about having to face anything that happened, and he's like really resistant to it, which happens to people when they're, facing things that they're really trying to protect, right? That he doesn't want
Mm,
to have all those feelings of shame and guilt and, you
mm,
know, the loss and the loneliness and all that stuff. So like he's pushing it away and he's pushing her away. The movie comes together when he does realize he has some like discussion with his dad in the clouds, and he like
mm,
really wants to like more integrate himself, right? Back in
mm,
like have some of his parts more integrated. He ends up going back and everything works out and he is able to face some of his fears
mm,
and stand up for what he learns is the truth. IFS is about connecting to yourself, but then when you can do that, you can connect to the other people around you in your community and your family and have much more healthy relationships overall.
mm. Basically, Simba has this horrible childhood trauma,
Hmm.
and he uh, he literally has to run away. And so he
Hmm.
internalizes this experience as, I killed my dad, basically. It's my fault.
Right. It's my fault.
And so to go back to Pride Rock would be to face that exiled part of him. And to do that means to also confront those feelings that come up, which is the
Right.
pain of the
Right.
trauma and the internalized guilt and all these
Yep.
things. And so the
Right.
firefighter part activates, which is the, no worries, we're just
Forget
gonna,
this. I'm out of here. Yeah.
which in for a real person that might be just saying, what, life's just about fun. We don't face trauma, we
Yep.
don't go there. We
Yep.
just we just have fun, we eat, we party.
Yep.
And that's a way of coping with the underlying feelings of the shame or the grief.
That's right.
In the movie, he has this moment where he sees his reflection. There's a ripple in the
Yeah.
water, and then he
Yeah.
sees Mufasa, his dad's face,
Right. That's right.
his own reflection. Is
Hmm.
that is that something that's relevant? Is that something that might represent IFS work in therapy? How might that manifest?
Sure. The ripple effect with him seeing his dad's face like was basically saying like it's okay, we can think about your dad, we can look at him,
Mm,
and he's a part of you. He looked at that, it made him consider some of those exile feelings. He faced some of them, he had like a dialogue with his dad. That's one of the ways in which IFS can help people connect to those parts, is having those internal dialogues.
So what does it look like in therapy? Let's say you have
Yeah.
a Simba client come in
Yeah.
and you're noticing there's this firefighter part, which is the it doesn't matter, life
Hmm.
is just about having fun, and yet
Yeah.
from the intake that there's this experience in childhood, this trauma.
Yeah.
Um, what does IFS look like in terms of the actual process of
Yeah.
getting from the person in firefighter mode to the self?
As a therapist, I would say my job is really just to help the client become more aware of the parts. Even just me using the word parts brings
Mm,
about some curiosity for them of like, huh, like, okay, what else is there? And like
mm,
there might be some stuff I don't really fully understand about myself yet. Because so many people feel so much shame even around the protector parts, right? They feel
mm,
shame from their exile, but then they're also like kind of like the manager part's judging the alcohol use or binge eating or whatever it is that the
mm,
firefighter part's doing. And the firefighter part's like, oh, you're so stuck up to the manager part, right? Like
mm,
you think you know everything, you're a know-it-all, you're a perfectionist. Like we can't live that way, right? So
mm,
sometimes they're at odds and they need to really be operating a little bit more collaboratively. Even just identify what those parts are and really emphasizing the difference between, having a judgmental approach where, they're critical of their parts as
mm.
opposed to really trying to understand what the motivation is.
I think the lack of judgment piece is important because what a lot of people might do is say, "Oh, Simba, look at what you're doing. You're avoiding all your problems. Look how selfish you are. You're out here enjoying yourself and having a good time. You need to get your shit together."
Yep.
That's kind of
A
like
lot of people would do that.
yeah, that's like the manager, the teacher, whatever that is. That's the way we kind of conceptualize
Nala did
that.
that, I think.
Yeah, yeah. That's kind of like the
Yeah,
the surface level way of viewing a firefighter part. Whereas the empathy part is saying the reason you're doing this is because of how deeply wounded you are.
yeah, you
Maybe
know.
the second videos, what firefighter part was going off in Scar when he kills his brother.
Exactly.
Uh,
We need a whole other discussion about Scar and all the villains and what parts are coming out for them that
mhm.
lead to their behaviors, right?
Yeah, I mean, there's no bad parts. Is
Right,
like Dr. Schwartz said, there's never been a part that he hasn't liked. And that so
right,
that would include Scar
right,
killing his own brother. There's an exile in there. Even
right,
people that hurt other people
right,
and engage in what we might call, evil, quote unquote,
right,
acts is fundamentally
right,
protective in some way. It's just
right.
harder for us to
Sure.
sympathize with it.
Right. And I'm really glad you brought this up because I do think that sometimes IFS has that critique, right? That's like,
Mm,
okay, but there are people who actually murder people. And are we just saying, like, okay, well,
mm.
but they have this little part of them inside that, is
Yeah.
excusable. And it's not. It's not excusable to murder someone. But if you're trying to heal, which I mean, I think there are different schools of thought about whether or not people should heal after they've done something awful, right? Like, should
Mhm.
they be allowed to heal? Should they be allowed to repair? Right. And,
Wow.
you know, I think it's really up to each individual person to decide for themselves, like, do you want to live your whole life as an exile or, you know, in this burdened protector part, or do you want to try to integrate a little bit, right?
Mm.
And that's a personal choice. You can do that internally, whether you have a therapist or not.
Do you have any words for people in terms of why it might be helpful or what type of person might
Yeah.
benefit from it?
Yeah. I would say most people would benefit from this. I think it's, therapy generally, I would say,
Mm-hmm.
is an untapped resource by a lot of communities
Mm-hmm.
that I really encourage people to consider. I think just making sure that you have space in your life to like have some breathing room. You'll have feelings about things that you're not expecting. And yeah, it's just important to be taking care of yourself.
Thanks for doing this. I really appreciate it.
Absolutely. Anytime.